Atëherë po fillon. I nderuar kryetar i Akademisë Shkencave dhe Arteve të Kosovës, akademik Mehmet Kraja, i nderuar zëvendës ministre e shëndetësisë zonja Dafina Gegja, të nderuar akademik, të nderuar pjesëmarrës këtu, ekspert shëndetësisë dhe pjesëtar tjerë të pranishëm. Sot kam kënaqësinë që në emër të seksionit shkencave të natyrës të Akademisë Shkencave dhe Arteve të Kosovës, t'ju shpreh falënderim për praninë tuaj në këtë ligjëratë të cilën e organizojmë për hir prezencës të një eksperti të shquar botëror, akademikut Vinko Dolenc, i cili është antar i rregullt i Akademisë Shkencave dhe Arteve të Slovenisë. Kjo ligjëratë organizohet në kuadër bashkëpunimit të cilin e ka Akademia Shkencave dhe Arteve e Kosovës me Akademinë e Shkencave dhe Arteve të Slovenisë. Atëherë, duke mos marrë më tepër kohë, unë do t'ja jap së pari fjalën profesor Arsim Morinës, i cili do të bëj një prezantim të shkurtër të biografisë të profesor Dolencit dhe pastaj do të vazhdojmë me ligjëratën e profesor Dolencit.
I nderuar kryetari i Akademisë, akademik Kraja, zëvendës kryetare e Akademisë, akademike Pula, zëvendës ministre e shëndetësisë zonja Gegja, të nderuar antarë të Akademisë, të nderuar kolegë, të nderuar pjesëmarrës. Sot kam dirin dhe privilegjen që të prezantoj shkurtimisht akademik profesor Vinko Dolencin. Dhe konsideroj që sa e kam vështirë, aq edhe është e lehtë. Është vështirë për arsye se nuk është lehtë që të përshkruhet veprimtaria e tij tërësisht për kaq kohë, kurse në anën tjetër është e lehtë për arsye se një e tërë bota akademike neurokirurgjike. Vinko Dolenc lindi në vitin 1940 në Ptujt të Slovenisë, u diplomua në liceun në Ptujt dhe studioi mjekësinë në Ljubljanë. U diplomua në vitin 1966. Specializimin nga neurokirurgjia përfundoi po ashtu në Ljubljanë në vitin 1974, ku në të njëjtin vit edhe mori titullin e magjistër nga neurokirurgjia për të doktoruar pastaj në vitin 1977. Ai filloi me teknikat mikrokirurgjike fillimisht në laborator dhe më pas në sallën e operacionit në vitin 1969 dhe ishte ndër pionerët e mikrokirurgjisë në Evropë. Mbi punën e tij mikrokirurgjike për riparimin e nervave periferik, botoi disa punime në revista neurokirurgjike. Në këtë dekadë, ai organizoi 4 punëtori për mikrokirurgjinë në Ljubljanë, të ndjekura nga një numër shumë i madh i neurokirurgëve të rinj nga lindja dhe perëndimi aso kohe. Në vitin 1974 filloi me teknikat mikrokirurgjike në kirurgjinë e aneurizmës. Midis aneurizmave të operuara, punë pionere të publikuara paraqesin resekimet e aneurizmave dhe rekonstruksioni i arterieve përkatëse. Profesor Dolenci ishte ndër iniciatorët në mbar botën, duke përkrahur kirurgjinë e aneurizmës në fazën akute dhe këtë model e ndoqi deri me rigorozitet. Është e panevojshme të thuhet, por kjo qasje e re provokoi aso kohë antagonizëm të konsiderueshëm si në qarqet vendore ashtu edhe në ato ndërkombëtare. Kuptohet, kjo ishte e vështirë të akseptohet nga neurokirurgët të themi të moshuar, pastaj edhe nga një numër i neurologëve dhe neuroradiologëve të pranonin qasjen aktive dhe të favorizonin operimet në fazën akute. Në simpoziumin ndërkombëtar për trajtimin e aneurizmave në fazën akute në Graz të Austrisë në vitin 1981, ai prezantoi përvojat e tij me hapjen e lamina terminalis të ventrikulit të tretë për të liruar langin truro-shpindor në mënyrë që të pengoj shfaqjen e një hidrocefalie pas operative. me të padrejtu kritikua, edhe pse kjo metodë 2 vite më pas vetëm është bë standard i punës në rastet e tilla. Sfidë të madhe për te ishin aneurizmat në majën e arterjes bazilare. Për kolegët nga mjekësia është e qartë. Punimi i parë mbi këtë temë ai botoi në British Journal of Neurosurgery qysh në vitin 1987, që kur ai punoi dhe studioi korridorin drejt objektivit të majës së arterjes bazilare dhe të cilën pastaj e shpjegoi e përshkroi në detaje edhe në librin e tij Anatomia mikrokirurgjike dhe kirurgjia bazës së Kafkës. Aso kohë numrin e vlen për të cek që aso kohë numrin e aneurizmave që i ka operuar në fazë akute kryesisht gjatë natës, kishin arritur tashmë 50% të gjitha aneurizmave të operuara aso kohë në departament. Duke filluar nga historiati nga viti 1965, Parkinsoni ishte i pari që realizoi një studim anatomik dhe propozoi një qasje kirurgjike ndaj sinusit kavernoz. Pavarësisht zhvillimit të teknikave mikrokirurgjike, në vitet e 70 mendohej se mikrokirurgjia ka arrit kufijtë e saj më të largët në afrimin e lezioneve brenda dhe rreth sinusit kavernoz. Rreziku i jashtëzakonshëm i lartë i dëmtimit të strukturave nervore, si dhe shkaktimi i hemoragjisë së pakontrollueshme, rrjedha të langut turoshpindor, dukej se ishin pengese pashmangshme dhe pakapërcyeshme. Por fal punës anatomike të profesor Dolencit dhe përvojës së tij kirurgjikale, përfundimisht u zhvillua një qasje racionale kirurgjike dhe u përcaktuan marrëdhënie të ndryshme midis lezioneve dhe strukturave neurovaskulare. Për të promovuar idenë e qasjes direkte mikrokirurgjike në hapësirën paracellare, do të thotë në një region të delikat, që e punoi me përkushtim, ai organizoi simpoziumin e parë ndërkombëtar mbi sinusin kavernoz në Ljubljanë në vitin 1986 dhe botoi librin Sinusin kavernoz, një qasje multidisciplinare ndaj lezioneve vaskulare dhe tumorale në vitin 1987. Që nga i takim, tema e patologjive të bazës së Kafkës, si dhe studimet anatomike në sinusin kavernoz, u përfshin në shumicën e takimeve neurokirurgjike anë e mbar globit. Në 2 dekada, profesor Dolenci organizoi dhe mori pjesë në qindra seminare dhe punëtori të shumta, intenzive praktike për anatominë e bazës së Kafkës të kombinuara me demonstrime të drejt për drejta direkte të operacioneve. Gjithnjë më shumë të neurokirurg të rinj u interesuan për anatominë dhe kirurgjinë e sinusit kavernoz. Kështu që nuk ishte në gjendje që të gjithëve t'u jepte shpjegime në pyetjet e tyre. Andaj u paraqit nevoja si zgjidhje vetme që të bëhet ta botoj një manual, një libër lidhur me sinusin kavernoz. Kështu e botoj librin Anatomia dhe kirurgjia e sinusit kavernoz, që u shtyp në vitin 1989. Libri ishte bestseller dhe u shit në më pak se një vit. Ky u prezantua në simpoziumin ndërkombëtar në New Delhi, po atë vit në New Delhi. Vlen për të cekë se në parathonjen e librit të profesor Dolencit, profesor Jashargili, që ne e konsiderojmë në botën neurokirurgjike babën e neurokirurgjisë bashkohore, me të drejtë shprehet kësaj citoj. Dr. Dolenc tani paraqet një punë pionere mbi mikroanatominë dhe ndërhyrjet kirurgjike të këtij rajoni kompleks. Nuk ka dyshim se ky lloj studimi anatomisë mikrokirurgjike është një hap i ri në historinë 100 vjeçare të neurokirurgjisë. Pastaj në vitin 2003 e botoi librin Anatomia mikrokirurgjike dhe kirurgjia e bazës së qendrore të Kafkës, që është një përshkrim i qartë i anatomisë dhe i procedurave kirurgjikale në këtë fushë. Është përkthyer edhe në gjuhën kineze. 20 vite pas simpoziumit të parë ndërkombëtar mbi sinusin kavernoz, organizoi simpoziumin e dytë ndërkombëtar mbi sinusin kavernoz në Ljubljanë në vitin 2006. Në këtë takim u diskutuan dhe u vlerësuan arritjet e 20 viteve të punës së bazës qendrore të Kafkës nga ekspertë kryesor të fushës nga shumë vende të botës. U sugjeruan pamje të reja të kërkimeve dhe trajtimeve të patologjive komplekse dhe shumë të vështira të këtij regioni. Dhe rrjedhimisht nga kjo u botua dhe libri Zhvillimet e sinusit kavernoz dhe perspektivat e ardhshme në vitin 2009. Po ashtu, edhe kjo është përkthyer në gjuhën kineze. Pas simpoziumit të dytë ndërkombëtar mbi sinusin kavernoz, profesor Dolenci krijoi Institutin Ndërkombëtar për Neurokirurgji dhe Neurokërkime, ku ai me ekipin e tij mund të vazhdonte me kërkimet neuroanatomike, me punën klinike me pacient dhe me mësimdhënie. Profesor Dolenc ka qenë aktiv në studimet anatomike të bazës qendrore të Kafkës, si dhe në punën klinike brenda dhe jashtë vendit. Ai mes patologjive të tjera operoi me mijëra pacient nga këto patologji vaskulare dhe tumorale të bazës së Kafkës, si në shtëpi, ashtu edhe në mbar globin, duke filluar nga Japonia, Kina, Pakistani, India, Australia, Zelanda e Re, pothuajse në të gjitha vendet e Amerikës Latine, në 22 shtetet e SBA-ve, në të gjitha ato evropiane, duke pas pacientin çdo herë në qendje të vëmendjes. Profesor Dolenci është antar i plot i Akademisë së Shkencave dhe Arteve të Slovenisë, antar i Akademisë Evropiane të Shkencave dhe Arteve, antar i akademive të shumta të huaja ndërkombëtare dhe është antar i shumë shoqatave neurokirurgjike dhe institucioneve të tjera kryesore neurokirurgjike në botë. Është ambasador i shkencës slovene në botë e që është justifikuar që nga pavarësia e Slovenisë. Cilësitë apo virtytet jashtëzakonshme njerëzore që e karakterizojnë të tilla si këmbgulja, personaliteti kurreshtar, talenti i lindur, përkushtimi dhe inteligjenca e jashtëzakonshme e bëri atë që të birësohet në grupin e etërve të neurokirurgjisë. Ai ka qenë shef i departamentit të neurokirurgjisë për më shumë se 2 dekada. Me operacionet e tij në fushën e neurokirurgjisë, Slovenia u bë qendra e botës neurokirurgjike. Kurdo që donte të vinte në vendin e tij, ishte gjithmonë i mirëpritur dhe përfitonte nga puna e tij neuroanatomike dhe nga puna e tij klinike në Ljubljanë. E tash, me të drejtë, mund të pyesni për lidhmërinë e tij me Kosovën. Që në vitin 1972, profesor Dolenci, aso kohë mjek i ri, ishte vullnetarisht në Kosovë për trajtimin e epidemisë së lisë apo të variola verës, e që kishte kapluar aso kohë Kosovën, vendin tonë. Ndërkaq 11 vite më pas, unë kam pas fatin, nderin dhe privilegjin që 4 vite, 24 orë, 7 ditë në javë, nga viti 83 deri në vitin 87, të jem nxënës i profesorit. Dhe dijeni mësuar pastaj të aplikoj tek ne. Kur pas specializimit tim, i kisha mundësi që të ndalem për të punuar në Ljubljanë. U ktheva në Kosovë për ta zhvilluar neurokirurgjinë bashkëkohore tek ne. Dhe sa më kujtohet në fletoren e kujtimeve të profesorit, e shkrova, jo 4 vite, por tërë jetën mund të mësoj nga ju. Por njeriu tërë jetën është bozhli dhe duhet të jetë mirënjohës vendit të vet, prindërve dhe mësuesit. Andaj konsideroj që jo vetëm unë, po edhe vendi im duhet të jetë mirënjohës akademikut profesor Vinko Dolenc. Për fund të thosha se çdo grup frazash apo fjalimesh rrezikojnë të jenë të pamjaftueshme dhe janë të mangëta, kur synimi është të përshkruhet madhështia e profesorit. Dhe aq më tepër kur bëhet fjalë për dimensionin dhe trashëgiminë që e madhe që ai e ka. Lus profesorin e nderuar që ta marr fjalën për prezantim. Prosim gospod profesor që preuzamete za besedo.
First of all, thank you very much for this too much credit. Dear friends, members of the Kosovo Academy of Science and Arts, and the other honorable people from Kosovo government, and colleagues from different specialties. Today I would like to share with you some of my experiences during my life. I hope I will not be too long. and I appreciate very much your time and your politeness to attend this meeting. As it was said already, I was in Kosovo 50 years ago, and this is a special occasion today to be again on the invitation of Academy of Kosovo. I was thinking what to talk about. If I talk only about the medicine, it will not be correct. So I will do a melange of medicine and some kind of the way to show how it was done. And then at the end, I would like to turn to more general problem, which will be interesting maybe for everybody. So, is it true that there are no frontiers? For the winds, yes. For the waters, not always. Just recall the problem in Egypt and Nile and some other places. And with the thoughts, I was thinking, when you say something good, when you say something new, it will be accepted. No way. It does not go so easy. In my life, I see 3 periods, and I will talk mostly about neurosurgery. In the childhood and primary school period, I had questions as every child, but parents answered me when I asked why a horse has long head and why a man has a round head. They said, "You stupid. It is so." And I had to believe. Dogmas. They were not able to explain to me. And you had to believe. High school period was a bit different. We were living in Yugoslavia. And, the system was different. And there were some people who did not agree completely with the system. And they were put a little bit to the side. And I was a lucky student to live in Ptui, where people professors who did not agree with the system completely, they were put there. So I had the best professor for French, the best professor for mathematics and physics, and also for Latin, who were placed in Ptui. And these people, they were really somehow advanced to our thinking. The questions, they accept them, and they were even promoting. And they said that you have to understand why this happened, why that happened, and so on. And actually, they were stimulating our adolescent curiosity. And then, at that time, you may not know, but at our high school, we got an envelope which was closed, and there was written something about us when we went to the university. Of course, we were smart enough to open this because we had friends at the post. And we opened, and in my letter, it was written, "He can when he wants." We closed it, and I went to the medical faculty. Of course, I was refused. and then I had to go to other faculties and then to return 1 year later to medical school, and then I was accepted. And in medical school, why I choose the medical school? Because I was questioned about the matter, space, and time. And I thought I will be able to get the answers to this. Our generation was fortunate in Ljubljana because our professors at the medical school were not, they were local people, but they were studying abroad. Vienna, Praga, Padua, Milano, Paris, London. So they had an academical behavior, an approach to us. While now it is not so. We have a local people who were studying locally. They have not such a wide angle of the approach to the problems. What were different personal and wider touch to the reality? As a medical student, I was at the seaside and I damaged my right hand, which is invalidated. Cut the tendon and very, very long story how it was repaired later on because not repaired correctly at the first. And when I was as a student at the student exchange in United Kingdom, I had to assist a doctor at the operation, and I couldn't hold the liver. You know, he said, "You bloody Balkan people, you are lying, you are lazy," and so on. I said, "I cannot because my index finger is going backward." You are just making excuses. So finally, after surgery, he said, "Show me your index finger." I showed him. It was swollen, and the last phalanx went back. So he asked his friend, a plastic surgeon. He said, "Yeah, but of course your tendon is not working." And he said, "Why it is swollen?" He performed an X-ray. Believe or not, he found a needle in my index finger. In that moment, I was so ashamed for our Yugoslav medicine. So he took this needle out, and then Professor Dolenc, later on in Ljubljana, he repaired. He did a selective tendoplasty. More than 20 years later, when Professor Dolenc was already dead, his daughter told me that she found the diary of her father, where it was written that he performed 25 selective tendon replants and reconstruction, and only one is functioning. That's this one. I can bend my index finger. Otherwise, my profession wouldn't be possible. As a student in 1966, Britannia Airways crashed at Berniki, and I was there as a volunteer to help because the doctors didn't speak English, the sisters didn't speak English, and so on. And later on, Mr. Archie Mackenzie, the consul in Yugoslavia, came to Ljubljana, and he said that they would like to help us, to give us something what we need. And it is funny how different chiefs of different departments asked for different things. And my professor, later on, Professor Zhumer, he said, no, I don't need these usual things. What I need is operative microscope. In 1968, he got this microscope from England, which was not used by neurosurgeons in England, but by ENT people. And then we started with microsurgical techniques. Ljubljana Neurosurgical Department was founded by Professor Zhumer, and he was the visitor in neurosurgery department from Thierry de Martel in Paris in 1939. And de Martel, at that time, he was working under supervision of Babinski, who was the most famous neurologist in the history. Because Babinski told him, you can cut this and you can cut this. You cannot cut this, you see. So, but Clovis Vincent was the pupil of both. And of course, all of a sudden, he knew more than Babinski and de Martel. And then the war started, and Clovis Vincent went to the other place. In September 1939, Clovis Vincent had the first lecture in Sorbonne, and he began with his lecture like this. Messieurs, Mesdames, si le nom de Messieurs Desmartel est accolé à Monsieur Babinski, mon nom est accolé à tous les deux. And then from that moment, they became friends again. So my Professor Zhumer was working sometimes with Clovis Vincent in 1939, and then he wanted to organize neurosurgical department in Ljubljana, but of course then the war came and it was postponed till 1949. Microsurgical beginning in global field, it was not until 1968. At that time, Dr. Smith from Walter Reed Hospital in New York published the first work of peripheral nerve repair with microsurgery. Donaghy in Vermont, he organized a laboratory where young neurosurgeons could learn microtechniques. And Yashargil went to Donaghy at 67. And on the day when he wanted to go back, because he was not able to perform a microsurgical suture, at that moment, you see how critical moments occur in the life. He was talking with Donaghy and he said, this microsurgery is not working, I go back to Zurich. And then the nurse came in and asked Donaghy, what is going on? Why you are so loud? Oh, Yashargil is going home because he does not believe in microsurgery. Then this lady, respect the ladies, they have always good ideas. She said, Mr. Yashargil, we all people have a good and bad days. Why don't you try once again? On that very day, he succeeded to make a suture. And so he brought it to Zurich, to Europe. And I was fortunate to work and to visit Yashar many times. And I had a microscope at home in Ljubljana. I asked several people to help me to get some suture materials and some instruments. But it was not possible to perform a live surgery because the surgical thinking was out of the frame of microtechniques. And one day, I saw a friend of mine from the primary school. He was very sad, came out from surgical ambulance, and I said, "What is wrong with you?" And he showed me his hand was falling down. He said, "My radial nerve is not functioning." And the doctor said to me that nothing can be done. And in that moment, I saw my opportunity. I said, "Go back and tell him to write this, to put this on paper." He came in, and the doctor, the surgeon, the traumatologist said, "Go out, I told you everything. Nothing can be done." He said, yes, but please, I need the certificate. So he came with this certificate. Then I bribed anesthetists, nurses, doctors, and we operated him illegally during the night. And we reconstructed the radial nerve. 6 months later, this man was able to extend his fingers. I said, "Now you go to the same doctor." He went. And this doctor said, "I told you nothing can be done." He said, "I didn't come for this. I just would like to show you that I can move the hand." Who did it? This and this doctor. And he mentioned me. So from that very moment, I had the one person in clinical center in Ljubljana, beside Professor Zhumer, who was for me, who helped me. And then at first microneurosurgical meeting in Vienna, 1970, I was already able to present 5 cases of reconstruction of the injured nerves. But the usual local, but most probably global policy of the senior members is that at the beginning they don't allow you because you are trying to do something new. But when they realize that it is working, they give you too much. They say, "Okay, then just do it." And so I operate 5, 15, 25, 40, 70, 120 peripheral nerve injuries per year. I said, "But I'm not going to be suffocated with this work." And I found in Greek mythology story how Arachnoidea complained that she was so good as the goddess Athena. She said, "I can knit so good as she." And the competition for the refinery took place, and Arachnoidea was very good. But Athena still did not allow to her the whole recognition. And she said, "Now you will be knitting the Arachnoidea." the whole life. So this is the story. And how to save the method of microsurgery? I said, I cannot do everything because the population of Yugoslavia was over 22 million, and there were crowds of peripheral nerve injuries. So I said the only possibility is to disperse, to delegate this function. So to teach also the others. So we organized the meetings. In 1974, Professor Schumer asked me one day, "You will assist me in an aneurysm." So he opened the head, he came to the aneurysm, and then he said, "Now, you young man, you put the clip, but through the microscope, control." You know, this is completely the opposite as surgeons are doing nowadays. They send the younger people, they open, they prepare everything, the big boss comes and put the clip and they go out. And the younger colleagues, they are doing the job. But Professor Schumer did the opposite. So I consider him as my second father. Then I started the aneurysm surgery. The problems were immense. Personnel on the duty in the hospital, they got the same salary if they work during the night or not. So it was necessary to convince them that they helped me. Diagnostic procedures, the same. Why to do angiography during the night if we can do it tomorrow? And surgeries during the nights. And then intensive care unit personnel after surgery. So these were problems we met. But anyhow, as Dr. Asim already mentioned, half of the cases we operated in acute stage. Because I remember I was talking with the patient, because the policy was when you have the bleeding, subarachnoid hemorrhage, you have to wait in the bed for 6 weeks. I said, why? And the answer was because it is written so in the books. And my question was, who wrote the books? Doctors. So let's write the book, the new book. And it happens many times that many of those patients who had the first bleeding and then they were waiting for surgery after 6 months, 6 weeks, they had the second bleeding and they died. So this was natural selection. I said, it is not fair. So that's why I started with acute treatment. And then also in Japan, they organized several meetings because they were also advocating it. And these meetings were from 82 to 86. Now, microsurgery in the skull base. It was only possible with microanatomy studies in the lab, and then also to perform some cavernous sinus surgeries. The mens land could be managed surgically with extracorporeal circulation. So this was a pretty revolutionary. Why and how it started? One day I was asked by a senior doctor, neurosurgeon, to help him to operate on an incidental finding of a left large carotid ophthalmic aneurysm. It ruptured during surgery. We finished with plugging everything, the aneurysm and the artery. And of course, intraoperative rupture, clipping was impossible, packing of aneurysm and internal carotid artery, and fatal outcome. Relevant aspects. There were no preoperative discussions enough. Surgical acts due to lack of space were impossible. Post-operative explanations, many. There were thousands of if we would do this and if we would do that and so on. But the whole point was the space. And I started interrogating myself. Find the positive solution or leave neurosurgery. I was to the point to change my profession. And then I said, my second eye told me, do not accept the defeat too early. Or would you like to be only the carrier of genome? Or would you like to achieve something? To surrender to what? To be accepted professional dogmas, limitations, to the lack of knowledge of the anatomy, to the lack of drive to oneself. If you surrender to yourself, your life later on is difficult for the whole life. Blind believing in is much easier than to check and find a better answer. So we have to find a new approach in thinking, in acting, but how? Forget no man's land dogma and prove that there is no man's land. Nothing is impossible. This was very arrogant. How? With new ideas. But then I asked myself and told myself, don't be arrogant. The ideas are not coming like this. You have to work for this. But first you have to read. Read. Because maybe some people have had some similar questions before. And in reading Taptas, Glasscock, Parkinson, Rotten, I found a lot of the same ideas. And then I could combine and I could come to the conclusion that the most what can be achieved in the anatomy is to understand it. And the most what can be achieved in surgery is to make the practical use of the anatomy. But for that, you have to study. You have to study the skull base. You have to study the run of the carotid artery. You have to study how it looks like when you remove the anterior glenoid, what you find, where the membranes are, where the cranial nerves are, and how the cavernous sinus is located and filled with the venous blood. And there are triangles between them. This is left cavernous sinus posteriorly, where you can find the carotid artery in the petrous bone. The microanatomy studies revealed that the eyes cannot see what the brain does not know. When I wrote the first book, and I asked Professor Yaşargil to read the manuscript and to write forward. He said, I was also there. I was in the cavernous sinus, but I did not know where I were, because he did not know this anatomy. Then the international meeting in Munich was in 81. The anatomy of the cavernous sinus was presented, and 3,000 people, neurosurgeons, they said, he's insane. We have to put him into asylum in the psychiatric department. Only 2 people among them, P.V. House from California, he said, but maybe something is in this. Let's follow him. And my answer was, to convince neurosurgeons it's better than to give up. What meant more work. The cavernous sinus war started, and did not end yet, even more than 4 decades until now. Why? From this meeting in Munich, they started to include skull-based anatomy and surgery, and I had also this war, and why? I found this slide. Nothing is more clear than the things they have been found yesterday. It's very clear. Everybody believes. But nothing is more difficult to see or imagine than this, what will be discovered tomorrow. So we are in between knowledge and no knowledge. To fight this war, it is necessary to understand when or that the world is resting on the ignorance. The world is limited with dogmas, and the force overpowers the arguments. So it's not so easy. You just come and you say, this is so and so, and everybody is applauding, and they said, okay. So I said, more work is necessary. And I somehow imagined myself like to go through the jungle with a machete and to make a narrow passage. And the majority did not agree. But when I turned back, the followers built the highway already, because some people, they were following. Then they did believe. And then I tried with the first publication in 83. You believe or not, I got an answer from publisher, and 28 arguments were against the publishing it. Again, I said, this is impossible. This is impossible. And then I went to one of the editors, and I said, it's better if I stop this and forget it. He said, no. Just change a little bit your presentation. Change a little bit And I was working 3 more months on the manuscript to somehow make it a bit more acceptable. But with the second publication in 85, it was much easier. And that was the green light. But at the meetings around the world, I was bombarded all the time with well-known neurosurgeons, how this, how that, and so on. I said, I cannot answer this in 3 minutes. So we organized this cavernous sinus meeting, and how the area is charted, like a map, But now, the new problems. How to protect the cavernous sinus from would-be skull-based surgeons. There were many people, they said, oh, he is saying this, we will follow it, and that's it. They were killing people. And I was not happy about this. And then radio surgery took place. They said, oh, we don't need to operate, we can just irradiate and get out of the problem. Endovascular treatment, endoscopic surgery, and also many people, they said, oh, you have a bit of squint, it is not so important. Just wait and see. But how long? You see, radiosurgery, army was against us. Endovascular surgery was against us. They said we can embolize. And endoscopic surgery against. They said we can look through, but they could not remove the whole tumor. And my answer was bloodless, clean, safe surgery. If you follow these rules, you can do it. And then you can operate on such an aneurysm, which is compressing the optic nerve, and then you remove it, you reconstruct the carotid, and the function is preserved and complete. You have another huge aneurysm in the cavernous sinus with carotid artery. You have to enter and you have to resect it, and then you have to reconstruct it, and the patient is doing well. And basilar tip, the most important in this kind of surgery are the perforators. These are small arteries here. If you put the clip on them, or if you embolize, forget, the patient will die. So the problem was how to get space, how to get there safely, and how to exclude the aneurysm. Of course, we were faced also with tumors. As you can see here, the tumor is bulging into the brainstem. But after removal of the tumor, you see the brainstem regain the shape and volume, as it is seen from the lateral projection. Here, sorry, here you see the projection into the pons, into the brainstem, and there, where is no tumor anymore, the shape of the brainstem and the volume is somehow regained. Of course, I was under constant attack of world experts. How you do this? How is possible this? And so on. I said, I have to publish. And then I published this book at 89. But many things have not been known yet. So I was working in the lab further to be able to publish the second book, and hands off from the brain. Here is described the completely different approach to the region, extradural. So then the brain is not damaged. And then a patient who was a painter also, I operated on him for a large cavernous sinus tumor. He wrote to me, not everyone who does hit you with the knife is your enemy. Not everyone who does treat you without the knife is your friend. It's just somebody who get out of the problem. And then it went years and years, we were working, and 20 years later, I said, what has been achieved? We realized that the success rate is higher when the different modalities are correctly applied, combined. So maybe radiosurgery, but after surgery. Maybe endovascular, or maybe endoscopic. We realize that cooperation is superior to blind and competition. We are not at our department to fight against the other department who are doing something else. Why don't combine the forces, and then we will be able to succeed more. Nothing is complete. Nothing is definite. Everything is changing, and neurosurgery is not an exception. And one should not be proud of what she has achieved, but could be only happy that she has been an active member of the process. So be a little bit more timid. In addition to publications, 120 in papers, published comments on papers, 115, lectureships and invited speaker and so on, I also published the books. This was after the first meeting, and then after the second, and then we published this book, and then this was translated in Chinese, and so was also the other one. And then I also put together a so-called book, To Neurosurgery with Love and Passion. But you can read this, Nemo Profita in Patria. You are more recognized abroad than at home. But during that period, many people had visited our department, and the vivid discussions were always present. And of course, it was the profit for both sides. And what now? When it became clear that the medical science cannot explain the consciousness, I was naive. I thought with surgery, with microsurgery on the brain, I will be able to find out some answers. What is consciousness? When it starts, when it stops? No way. I did not achieve nothing. I only came to the conclusion that the brain is also an organ, as is cardiopulmonary, how is the lungs, digestive tract, and so on. This is an organ. This is an executor, but where from the orders? Do the animals possess the ability of awareness? Planning was my question. Yes, they do. They do. They understand when you say, oh, my pet is good, my dog is good, and so on. So, if so, we have to leave anthropocentrism and believe in the biocentrism. It's another approach. how we accept our limitations. Nobody of us is unhappy because cannot stay under the water without aqualunga. Nobody is unhappy because we cannot fly without a plane. These are our limitations. But there are also limitations due to diseases. We have to convince those people that the life has meaning also when we cannot walk correctly, when we cannot jump correctly, and so on. Now it is better to know something about everything than know everything about one thing. The French proverb says, but I hardly or not agree with it, because the above belief, the above brings us to outrageously and effortlessly decisions making. If we think we know, but we actually do not know much about everything, we can make wrong decisions. And Kundera described this unerträgliche Leichtigkeit des Lebens. Who is commanding to us what and why we have to do? We are doing what we have to do because of ourselves, because we have such a conviction, or because of the others. And so we are also doing the decisions. To know is far away from understanding. And here I bring a teacher with whom I was working a bit in the States, and that is Sir John Eccles. He got 2 Nobel Prizes. He was atheist. He was very, very strict scientist. But then he wrote a book, How the Self Controls Its Brain. You see, the brain is an organ, but the mind is controlling it. Where is the seat of the mind? That's the question. The truth, Felipe Fernandez Ernesto, he published a wonderful book about everything. You will say good day, and he will ask what for. How you know that I had a not bad day, and so on. So it is also a good literature for perplexed. And finally, what kind of creatures are we people? Ask himself Noam Chomsky, who is a great, great thinker. And then I like mountains. And once in the mountains, I met a German professor of philosophy, and we discussed different things. And then I asked him, but why you are going to the mountains? And he said, to find my own I. In German, das eigene Ich zu finden. We do not know what we are, what we can do, what we will do, and so on. So this is a mystery for us. Why? Because our knowledge is like a drop. The ignorance is an ocean. Portions of oppositions, physical status and the mind. That's the question. We are not the center, but only an experiment in the life. What is the point, the sense of our life? When I was working in Kolkata, in India, an Indian doctor said to me, not to be worse than the animals. The animals do not torture, do not kill for fun, do not do bad things. They kill only when they are hungry. And then I came to the Frederic Lenoir. He was studying Spinoza. It's a wonderful topic. And Frederic Lenoir, he's also the founder of so-called CV doctrine. CV, it means in French, savoir être, to know yourself, and vivre ensemble. You have to know yourself. You have to study your ego. You have to study your intentions. And then you will realize, you will maybe able to judge how you can live with the other people. Savoir être et vivre ensemble. Progress in medicine, higher possibility of survival, creates chronic states, new problems. You know, each step forward discovers more problems. We don't have the answer. Unconscious patients, injuries, trauma, and/or diseases are in front of us. How we behave, how we help them. Intensive active treatment, till when? Till when? Do not conduct the sporting battle between medicine and disease. This was the saying of our professor of medicine of law. And he said, there is time when you have to stop. But when? We had a pavilion where we put our unconscious patients which were stable, and this was for long run for basic treatment only, basic care. Care for chronic and invalidated persons is a monument for humanity of the society, is another saying of Professor Machinsky. So we have to live with invalids to get constant information how lucky we are until we are healthy. We are not invalidated. And to help them. Now, who determine the brain death? It should be objective neuroscience's methods. Now we come to euthanasia. In my opinion, it is not the topic for a referendum. No. Who put the frame? Politicians, medicine, law? Who could decide when the life has no more value and when the treatment care should be withdrawn and euthanasia allowed? I think medical science should have the predominant role in this. But promoters of euthanasia, they say euthanasia does not hurt the others. My answer is because euthanasia also should not benefit the others. I have examples when it was pressure. And now, I'm sorry to show you this. Neue Zürcher Zeitung. It is from Monday, 29th of April 2019. And it talks about new model, about not having enough organs for transplantation. So the possibility of abuse exists. So how to navigate between this? And then I have to mention a patient of mine, and she said she was a qualified medical doctor, and then she got a tumor, and she was operated by ENT and later on also by us. And every day she told me, I don't want to leave. I cannot socialize. I cannot go with my friends, with my colleagues. But before I realized that I do not want to live is not equal to I want to die, it passed a time. One evening I was very tired, working the whole day, and the first half of the night, I went to the bed and I said, I hope the second half of the night will be okay. Half an hour later, they called me. My first thought was, I hope that's not she, but this was she. The artery ruptured, and the spring of the blood was going out like this. I was in front of her bed, in front of her, looking at her. I didn't know what to do, how to react. And then this lady, she said, Doctor, do something, otherwise I will die. And I thought, but you said you don't want to leave. And then I realized, I don't want to leave is not the same, I want to die. Many people say, I don't want to leave. But it does not mean I like to die. So we took her to the operating theater, fixed the artery, and 20 more years she was working as a doctor. I have to mention Cittadella from Cronin and his contenance of doubt. When we are deciding critical situations, we have always to leave a piece of doubt that we did not take into consideration all the possibilities, and we can profit from the other opinions too. Personal experience, too quick decisions are not correct. No return possible. When you say, he has no chances, you stop treatment, there's no way back. And it happens once. In one Saturday evening, I was collecting my slides because on Sunday I went to America, and then I got a phone call and they told me that a young person, 30 years old, he had a car accident. I said, but I'm working on this, I have no time. Please have a look. I went down. It happened in our hospital. I went down. I said, did you have this and this patient? Oh, yeah, nothing with him. I went to the room. They put him into the room without treatment, without help. And of course, I got panic attack. I started shouting. I said, put immediately the canal and so on. He is still walking in Ljubljana streets more than 30 years afterwards. So too quick decisions are not good and should never be taken. You have to give everybody the chance, at least at the beginning. from anthropocentrism to biocentrism. Beyond biocentrism, what is required of rethinking time, space, consciousness, and the illusion of death. No frontiers. The final solution is the equation of everything. And this I put to you, and you may think about it, and you may get the answer. Thank you very much.
Thank you very much. Faleminderit shumë, profesor Dolenc. Tash për shkak të kohës shkurtë që e kemi, ndoshta do të ketë kohë vetëm për një koment ose pyetje të shkurtër, nëse ka dikush prej publikut. Atëherë, nëse nuk ka, besoj tash do të ketë edhe një pauzë shkurtër, do të jetë një koktej i vogël këtu në hullin e akademisë dhe besoj të gjithë mund të shtrojnë ndonjë pyetje ose bashkëbisedojnë sa do bak me profesor Dolencin. Ky është edhe fundi i pjesës zyrtare tash të këtij organizimi që e kishim sot, dhe edhe një herë kërkoj për publiku ta falenderojnë profesor Dolencin. Coffee break still.
Okay.
So people probably will